Hi everyone, thank you for tuning in to my YouTube channel, Dear New Nurse. If you have not subscribed yet, go ahead and click that button down below and subscribe. The goal of my channel is to shoot out videos for you to view if you are a new graduate nurse, just to keep you encouraged in your journey as a new grad nurse. So it has been a couple of months since I put out a video, about 5 months, and that's because we've been in the middle of a pandemic. So nursing in the middle of a pandemic has been an experience, to say the least. But I am getting through it. I don't work directly on a COVID unit in my hospital, but I have come across um, a number of patients who were COVID positive. So just trekking through this whole phase that we're in, this whole season that we are in our country of dealing with the pandemic, I just kind of pulled away and really focused on the task at hand and just tried to gather my thoughts, being a essential worker in the middle of a pandemic. But I am back again and I am hopping on. And in this video, I'm going to share a couple of tips for my new grad nurses. So for those of you who have graduated and you passed your boards and now you have secured your first job in the career of nursing, you are probably in orientation right now if you're watching this video, or you are about to start orientation. So grab a pen, some paper, grab your phone, whatever, and take some notes, because these tips that I'm going to share with you actually are tips that help me get through my orientation. So let's go. So first tip, when you begin orientation, you want to come with the intentions to learn as much as you possibly can from your preceptors. So one of the biggest things that helped me was having a little journal. I call it my little black nursing book. And on any unit where I was newly orienting, I would bring this journal and I would just write down in the journal codes. I would write down my passwords. You might want to be careful with that, but I was comfortable with doing that. I would write down just anything that I needed to know about the unit. I would write down resources and websites and phone numbers and processes sometimes, or certain way of doing some skills that needed to be done for patients. I would write those things down in that book. So that book was like my nursing Bible, and it really helped. I didn't use it every day, but if I needed to refer back to something, I was able to go to my backpack, grab the book, and look it up. So it just made it so easily accessible to pull out information that I needed. Like if I forgot a passcode, I could go to my book and pull it out. Maybe you want to do it on your smartphone. If you want to do that and you like that method better, then by all means. But for me, I love to write stuff down. I like to have it on paper. I like to put the pen to the paper and really write things down. So that helped me throughout orientation. And then just jotting down little nuggets that my preceptor had on how to do certain things throughout the unit. I would write those down as well. So it kind of makes me leery of those new nurses who begin precepting or orienting to a new unit and they are not writing it down. I'm like, how are you remembering all of this stuff? Maybe you have a great memory, but I need to write stuff down. It helped me, and I'm sure it will help many of you in your orientation. The next biggest thing that I want to encourage those who are new grads to do is to ask questions. Ask as many questions as you need to. So when I was orienting as a new grad, one of the things that I was not comfortable with, that I should have been comfortable with, was asking questions. As a new grad coming on to a unit that you have never been on, you're right out of nursing school, you don't know too much of how this unit operates. There's so many questions that you have and that you need to ask so you can know how to do your job. So my motto is, if I don't ask the question that I need to ask, then I'm not going to know how to do what I need to do. And then the thing that I need to do won't get done. So ask. There is never too many questions that you can ask. And sometimes, we can internalize within ourselves, hey, I feel like I'm asking too many questions. Maybe that's a dumb question. Maybe that's a stupid question. Like, have I used up all of my questions for the day? No, ask the question, no matter how crazy it may sound. No question is dumb. And if someone who is supposed to be training you or teaching you is making you feel like your question is dumb or that you should already know the answer to that, then you might need to talk to a supervisor or manager on your floor. So ask your questions. The only way you can know how to do something is if you ask. And if you don't, then you're not going to know how to do it, and you're not going to do it correctly. And then you can put yourself in jeopardy while taking care of patients' lives. So don't be afraid to ask questions. You can never ask too many. Ask and ask again. My next tip that I want to share with you is to know your resources. So in your hospital orientation, they go over the resources, how to access the policies and the procedures of your hospital, how to access the educational resources. And during those times, we kind of tune it out, or at least I did during my orientation. But then a couple of times when I was orienting, or even as an experienced nurse, I needed to use these resources and then had to go through a hassle trying to figure out where to go, how to access them, wasting time because I didn't know how to access the resources. So know how to access your resources. Know who your manager is, of course. Know who your supervisor is. Know how to access the policies and the procedures of your institution on their website. Know how to access the drug manuals. So know how to use and access your resources. This will save you time on your unit, time in your workday if you ever need to use resources to get something done. My next tip is working on proper communication. So that SBAR that you learned in nursing school, yes, you're going to use it here in the hospital. So I encourage you as new graduate nurses to practice your SBAR so that when you need to communicate with a doctor or someone on your team, you can communicate clearly. You never want to be found not able to communicate something that's going on with your patient or something that's going on the unit. So practice while you're at home, practice with your preceptor, and it'll start to ease up the nerves that you might have with communicating with doctors. I noticed that that's one of the biggest fears or points of anxiety with new nurses. It's confidently and effectively communicating with physicians. So if you practice with someone or you practice at home communicating just in a mirror or recording yourself, then it'll make it easier when you actually have to do it in real time. So practice your communication. My next tip is to be friendly. So when you're working with people, you are bound to experience people who are nice. You are bound to experience people who are not so nice. But as a new graduate nurse coming onto a unit that you have never been on, you need to be friendly. Even if you're shy, just learn how to speak and say hello. Learn how to introduce yourself. Go up to a new coworker and say, "Hi, my name is Teslin. I'm the new graduate nurse on the unit. Nice to meet you." Be friendly, be open to communicating and forming work relationships with the coworkers that you're going to be working with. And let me tell you, being friendly on your unit goes a long way. There are going to be people on your unit. This has happened everywhere that I've worked. There are going to be people on your unit who are super friendly and they're outspoken. They're always willing to help you. They're always checking on you, especially as a new graduate nurse. And then there are going to be those who are kind of closed off. They don't really say too much. They come to work, they get their assignments, they do their job, and they go home. But you as a new graduate nurse need to be friendly always. And if that is not something that is natural, on the inside of you to be friendly and approachable, then you need to develop that. If you're friendly, people are more likely to help you when you are in need of help. Don't be that nurse who always walks around grumpy with an attitude and mean and just not helpful. Don't be that nurse, because then if you get in a position where you need help that day, you need your team to come together and really help you, then people are not as inclined to help you as they would be if you were friendly. So be kind, be nice. And next, don't let bad days get you down. So in nursing, you are gonna have some days that are really good. Your patient assignments seem to be smooth. Your day just flows really nicely. And then there are days where things just hit the fan, right? And you do not know when those days are going to be, unfortunately. So you have to be prepared. You have to come to work prepared for the day to go well or for the day to just go in a completely opposite direction. And when those days happen, don't let the tough days get you down. It's so easy to let the bad days really put a damper on you and really get you down and get you just focusing on the things that you should have done, that you could have done differently. But learn how to embrace those bad days, because I promise in those days that you call bad or in the tough days that you have, you're learning new skills, you're learning new ways of better managing your time. So learn to embrace the tough days. And one of the things that I like to do as a new graduate nurse was at the end of the day, at the end of my shift, when I had some downtime, I would write in my journal things that I liked, how I did during that shift, and things that I felt like I could have done differently, or I could have gone back and did better. So don't let your bad days get you down. Learn how to embrace them and learn how to grow from them. And then lastly, be confident. Be confident, even on the days where you don't feel confident. Be confident. Patients can see it. Your coworkers can see it. Everybody around you can see it. So if you are confident, even if you don't know a certain skill, a certain drug or medication, then be confident still. Don't let your lack of a knowledge in a particular area or skill make you feel dumb, make you feel like you don't know anything. Confidence goes a long ways in your nursing care and how you conduct your day. And you can boost your confidence in your nursing and in your patient care by studying your skill, doing research, making yourself better, learning your medications, learning your drugs, learning the skills that you need on that floor, learning the disease processes that are always seen on the floor. And then trust that as you continue in your orientation, as you grow as a new graduate nurse, then your confidence builds, your confidence increases. So I just wanted to share these tips to all my new grad nurses out there to hang in there, especially if you are working right now, if you are a new graduate nurse in the midst of the pandemic that our nation is facing. Man, hats off to you. You are courageous, you are bold, and you are doing the thing. So hang in there. It gets better with time, and don't give up.